A ganglion cyst is a non-cancerous lump or swelling that typically develops along the tendons or joints of the wrists, hands, ankles, or feet. It is filled with a thick, jelly-like fluid and can vary in size, growing larger or smaller over time. While usually harmless, ganglion cysts can sometimes cause discomfort or interfere with joint movement. The exact cause of ganglion cysts is not fully understood, but several factors may contribute to their development. Joint or tendon irritation. Chronic irritation or trauma to a joint or tendon may cause the formation of a ganglion cyst. Joint and tendon overuse. Repeated stress on joints and tendons, particularly in the wrists or hands, common in athletes or those with physically demanding jobs, may lead to cyst development. Underlying joint conditions. Arthritis, particularly in the wrist or fingers, can increase the risk of ganglion cysts forming. Symptoms. Ganglion cysts can range in size from small and barely noticeable to larger, more prominent lumps. Symptoms may include visible lump. The soft, round lump typically found on the wrist, hand, or fingers. Less commonly, they can appear on the foot or ankle. Pain or discomfort. While many cysts are painless, larger ones or those pressing on nearby nerves can cause pain, aching, or discomfort, particularly with movement. Restricted movement. If the cyst is near a joint, it may cause stiffness or limit the range of motion. Numbness or tingling. A cyst pressing on a nerve can lead to sensations of numbness, tingling, or weakness in the affected area. Diagnosis. Diagnosing a ganglion cyst usually involves physical examination. A healthcare provider will feel the lump and assess its size, shape, and movement. Imaging tests. X-rays, to rule out other conditions such as arthritis or bone tumors. Ultrasound can determine whether the lump is solid or fluid-filled. MRI, used in rare cases to provide detailed images of the joint and cyst. Aspiration. The doctor may insert a needle into the cyst to remove some of the fluid. Aspiration for further analysis or to reduce its size. Treatment. Treatment for a ganglion cyst depends on its size, symptoms, and how much it affects your daily activities. Common treatment options include observation. If the cyst is small, painless, and does not interfere with movement, no treatment may be necessary. Many ganglion cysts go away on their own. Aspiration. A healthcare provider may drain the fluid from the cyst with a needle, relieving pressure and reducing the size. However, cysts often recur after aspiration. Immobilization. Wearing a wrist or ankle brace can reduce movement in the joint, allowing the cyst to shrink and symptoms to improve. Surgical removal. If the cyst is large, painful, or keeps returning after aspiration, surgery. Ganglionectomy may be recommended. This involves removing the cyst along with part of the surrounding joint capsule or tendon sheath to prevent recurrence. Home remedies. Avoiding activities that cause joint stress may help reduce cyst size or prevent discomfort. However, it is not advised to attempt draining or popping the cyst at home, as this can lead to infection or complications. Complications. While ganglion cysts are generally benign, complications can arise in certain cases. Recurrence. Even after treatment, ganglion cysts can return, especially after aspiration. Infection. If a cyst is punctured or drained improperly, there is a risk of infection. Nerve compression. If a cyst presses on a nerve, it can cause persistent pain, numbness, or weakness in the affected limb. Prevention. There is no definitive way to prevent ganglion cysts, but certain steps may help reduce the risk. Joint protection. Avoid repetitive movements or activities that strain the joints, particularly the wrists and hands. Strengthening exercises. Strengthening the muscles around joints may help protect against joint injuries and cyst formation. Early treatment. Addressing joint or tendon irritation early can help prevent the development or worsening of a ganglion cyst. Conclusion. Ganglion cysts are common, benign lumps that often resolve on their own or with minimal intervention. However, if they cause pain, discomfort, or limit movement, medical treatments like aspiration or surgery can provide relief. If you notice a persistent lump or experience symptoms related to a cyst, it is important to consult a healthcare provider for a proper diagnosis and treatment plan.